Okay, well, welcome everyone to the BC Support Unit webinar series. I'd like to welcome you to today's webinar, which will be about an hour in length. And I'd like to begin the webinar by acknowledging the traditional territories of the Musqueam, Tsleil-Waututh, and Squamish nations from whose traditional lands we're leading this meeting today. You may have noticed that we've muted you as you've joined the webinar to avoid background noise during the presentation. We encourage you to use the chat box to share questions for a discussion at the end of the presentation. The chat box can be found in the top right area of your screen. At the end of the presentation, your microphone will be unmuted so you can ask questions using your microphone or via the chat box, whichever you prefer. This webinar is being recorded and will be available on our website, bcsupportunit.ca, under Resources, so you can share it with your friends and colleagues. Today's webinar is being presented by Shazhan Amed at BC Children's Hospital, who will be presenting an introduction to child-size KT. And I just heard a little bit of background noise there, and I'm going to find out where it's coming from. No, we're good. So Shazhan, I'm just going to pass the presenter ball over to you, and then we can get underway. There you go. So you should be able to share your screen now.
Okay.
Perfect.
Okay. Does that work?
Yeah, great.
Great. Okay. Well, thank you for the opportunity to the BC Support Unit for giving me this opportunity to talk about some work that I've been doing with a team of people at BC Children's Hospital. So there's a list of co-investigators there who have worked with me on this project. And oh, I don't know why it's not advancing. Sorry, 1 second. There we go. I also just want to acknowledge the staff who have worked tirelessly to help get this work completed and moving forward. Jennifer Smith, Don Mount, and Russell Bonaguro, as well as our funders from the CHR and the Evidence to Innovation team at BC Children's Hospital Research Institute. So to start, I'm going to go through some of the vision statements that we have on the BC Children's Hospital website. BC Children's Hospital strives to respect people by putting patients and families at the center of all we do, achieve excellence through knowledge and innovation, and learn from the experiences of patients and families and value their ideas, and cultivate partnerships to improve health outcomes. It is critical that this vision that we have aligns with what we do as researchers, whether it be basic science, clinical, or population health research. Child-size KT, or child-size knowledge translation, is envisioned as a robust, interactive knowledge translation platform that will catalyze the engagement of children and their parents and healthcare practitioners and stakeholders in child health research. We hope, or our goals are, that the child-size KT platform will provide patients and key stakeholders with the opportunities to develop trusting relationships, as well as to enhance our learning and hold us as researchers accountable to patient needs and priorities to ensure that our research is meaningful and relevant to the people that we care for. And parents of patients at BC Children's Hospital feel the same way. We asked a few parents when we started to conceive this idea about what they thought of child-size KT. One parent said, being part of the child health research process at BC Children's Hospital would make parents feel empowered and more connected to the system. The more stakeholders who participate in research, the more valuable the research and its outcomes will be, and the better BC Children's can serve its community. Another parent said, by creating a knowledge translation platform at BC Children's Hospital, you would be giving a voice to all of the parents who possess a wealth of information. You would have a group of experts at your fingertips that could give you real-life solutions to theoretical questions, experts that could help derive hypotheses for research. So the learning objectives of this talk are to explore the idea of patient-informed research through an innovative platform called Child-Size KT, to understand patient or parent and healthcare provider and administrator and leader perspectives on patient engagement and research, And hopefully by the end, and although that I know it's challenging over a webinar, but to actively participate in a bit of a discussion on the design and function of this idea of child-sized KT at BC Children's Hospital and Sunny Hill. So the concept of patient and public involvement in research is not new. In 2012, Joe Brett and colleagues conducted a systematic review that included about 66 articles that reported on the impact of patient and public involvement at all key stages of the research process, from defining the problem to disseminating the new evidence. What they learned was that the overall patient and public involvement in research has positive impact, but it does come with key challenges. So let's look at the positive impact first. In the early stages of research, patient and public involvement helps to identify relevant research topics and prioritize those topics. The research becomes grounded in the day-to-day reality of users' experiences by developing their user-relevant research questions. Sorry, I just lost my track here. So also patient involvement will help to provide pragmatic criticism of research protocols, making sure that cultural issues that should be taken into account when designing a study are addressed, and also identifying important outcome measures that are important to patients. Of course, their involvement helps with the appropriateness of wording and timing of research instruments. When patients are actually involved in collecting the data, for example, through interviews, the researchers gain deeper and more personal insights because of the rapport and empathy that they can develop with research participants. In the analysis phase, emerging themes and trends are interpreted from the user perspective and can then be combined with the interpretation of academics. Research reports become grounded in the user experiences, and through the networks that our users have, more effective dissemination and implementation of research findings occur. However, we also know that there are some challenges with patient and public involvement in research. Scientific and ethical conflict in protocol design can occur. There can be tensions between what academic criteria are for what makes a good study versus user perspectives on what is appropriate research. Tokenistic involvement of users can result in power struggles when researchers involve users only to comply with policy or funder expectations. And this can create a very poor user experience in research. Of course, recruiting a broad range of perspectives, challenges in engaging hard-to-reach groups and vulnerable populations in the research process is something we all face. Maintaining confidentiality is a challenge, especially when users share personal stories. And then just looking at sort of the logistical aspects of research, groups can be dominated by the loudest or strongest voice. Research findings can be disseminated before academic publications, and there's time and cost required to actually engage the public in research. However, there are huge benefits to engaging patients and the public in the research process. And I think it's well depicted by this visual value model for patient engagement that I've adapted from the CIHR strategy for patient-oriented research. Researchers, healthcare professionals, and policymakers need to work together with patients to ensure a patient-oriented approach that improves both practice and treatment. Patients need to have the opportunity to provide input on identifying health research priorities, but also to participate in the design and undertaking of research projects. What this results in is research in areas that patients value, but also researchers and patients who understand the value of their involvement together as partners in research. Through this process, patients can influence and accelerate decision-making, translation, and uptake of new practices. And what we achieve then is our goal of improved patient experiences with the health system, as well as improved health outcomes. So going back to this idea of child-sized KT, which is really designed to engage children, families, and practitioners for better health care. I'm going to show you a cartoon that we've developed that we think represents maybe what child-size KT might look like, although I want to emphasize that this is a project that's in evolution, and we are taking a very participatory approach to its development. So what we have here as an idea can and will definitely change over time as we continue to do consultation. We see child-size KT as a network of patients, researchers, and stakeholders, as well as a platform that facilitates research participation across the entire research process. So when you look at our stakeholders, like patients, healthcare providers, decision makers, they could input into the system or the platform their experiences, their own ideas for priorities for research, their research questions, their own clinical data, their patient-reported outcome measures and experience measures. What they get out of interacting with the platform would be knowledge on research activities at the BC Children's Hospital Research Institute, new opportunities for participation across the research continuum. They could participate in the interpretation of emerging results and also receive health promotion messaging. When looking at what research input into the platform, it could be their ideas, their new discoveries. They could provide access to innovative treatment, and they could also provide health promotion messaging. What they get out of interacting with the system would be patients who are interested in participating in research. They could also collect data. Their research becomes patient-driven and hopefully will then enhance the impact of their work. So prior to actually building this platform, what we wanted to do was to engage patients, families, practitioners, and other stakeholders in a participatory approach to enable a meaningful and sustainable engagement for the design, development, and evaluation of this robust interactive KT platform called Child-Size KT. So over the next few slides, I'm going to share the results of this initial phase of our work, which was really a consultation and a participatory approach to developing this big idea, Child-Size KT. We used a mixed methods design. We conducted surveys with over 500 parents, 420 of whom were parents from across British Columbia, and about 100 of parents actually accessed care at BC Children's Hospital, mostly through the Pediatric Diabetes Clinic. We also conducted 2 parent focus groups with 8 to 10 participants in each group. When we did the survey and the focus groups, we demonstrated to the parents the research process, which is shown here in this cartoon. The steps in the research process were identifying the problem, developing the question, designing the study, collecting the information, analyzing and interpreting the information, and then sharing the results. Our discussion looked into things like previous experience participating in research, the benefit and likelihood of parent or patient participation in the research process, motivators and barriers to participation, and we also collected some demographic information on our survey participants. We also conducted a consultation with approximately 65 healthcare providers, researchers, administrators, and high-level decision makers. In these consultation meetings, we discussed topics such as barriers and facilitators to engaging stakeholders in research, the skills and resources needed to maximize engagement, strategies for engaging hard-to-reach populations, potential platforms and necessary functionality to support engagement, opportunities for collaboration, and obstacles or threats. So beginning with the results of the parent surveys and focus groups, we learned that parents generally feel that their input would benefit research a great deal at most stages. Parents specifically identified formulating the question, collecting the data, and sharing knowledge as key areas where they feel that their input would benefit research. Now the data in blue over the next few slides will always be the parents from across BC, and we've separated the parents of children seen at BC Children's Hospital just to get a sense of whether there would be any differences between these 2 groups. Parents were very or somewhat likely to participate in most stages of research, but you can see again that really where they felt their participation would be most likely would be identifying the problem, collecting the data, sharing the results. However, there's still some interest in participating in the other steps of the research process. We learned from our focus groups, however, that parents are more likely to participate in any of these steps if they understand the potential impact of the research. More than half of parents actually wanted to see all research opportunities and not just be notified or contacted for opportunities that were relevant to their child. So this was an interesting finding for us. However, in the focus groups, what we learned was that parents are drawn to research that is relevant and offers the potential to improve the life of their child. Parents were encouraged to learn that they could be involved in all stages of the research process and did express their interest in contributing. I'm going to share some of the data we collected, the qualitative data we have from the focus group. In terms of identifying the problem, a parent said, with parents living the experience, professionals might not even know the questions that we, parents, are grappling with. Participating in identifying the problem allows you to feel like that our personal needs are being met. When developing the question, your parents' own lens and experience will influence the types of questions and studies you do. Helping design the questions may help get an answer that might be useful. When designing the study, one parent said, I would prefer to design because then you have the power to come up with ideas to influence and examine the topic. Another parent said, there's nothing worse than getting to the end of a survey and not having been able to get your point across. But some parents were unsure of their qualifications related to analyzing and interpreting information, but they were very open to participating in the collection of data and sharing the research. Collecting information is perhaps the quickest and most gratifying way to feel like you are doing a part in research and making advances. With analyzing and interpreting, there was more uncertainty. I'm unsure I'm qualified, or it takes time and I'm probably not interested. But with sharing the result, one parent said, I can't imagine participating in a study without being interested in the results. Another parent said, you get the word out so you can help build and snowball the idea or findings and help more people that way. Almost all parents want to participate in research online. So between 90 and 100% of parents. Almost 50% want to participate in person. When we asked how they would use the online platform, parents are very likely or somewhat likely to use an online platform to find out information about research conducted at BC Children's and participate in research conducted. So they want to use it for information, but also to help engage them in the participation. But parents had several concerns about using an online platform, and privacy and security were of the utmost importance. In terms of security and anonymity, their questions were related to how secure will the site be, and is there any way that personal information can fall into the wrong hands? The question that came up a lot in the focus groups was, who has access to my information? We learned that parents are actually highly protective of their children's information and that there is valid concern among parents about how that information that they share in childhood could affect their child in their future. Encouragingly, BC Children's Hospital is actually a brand that parents trust. And so that also came out in the focus groups in that they would trust an online platform that was branded and emanated or emerged from BC Children's Hospital. In terms of other concerns, information and notification overload came up, concern that there could be too much information that would be provided through this platform, and particularly non-relevant information. They had concerns around technological issues like glitches, the size of the app, complicated login processes, issues with Wi-Fi, downloading or uploading that would be required, and even how it would impact their data usage. However, they did stress that the platform needed to be mobile friendly, and if it wasn't, that would create some frustration. Going to the results of the consultation with healthcare practitioners, administrators, and leadership. We spent quite a bit of time talking about facilitators and barriers in this consultation meeting. The lack of resources and capacity to support research activity was a recurring theme. Resources that were deemed necessary to engage patients in research was research support in clinic, as well as time and remuneration for research activities, as well as having better research infrastructure. Valuing patients and practitioners as collaborators was also an important facilitator. For patients and families, participants in our consultation felt that ensuring adequate compensation for things like parking, time spent away from work, childcare, etc., was critical. For clinicians and administrators who have heavy workloads, valuing their contribution was deemed extremely important. However, our participants understood the complexity of monetary remuneration and acknowledged that there could be other ways, non-monetary ways, of remunerating their participation, including CME credit, or something as simple as providing lunch or dinner were suggested. Interpersonal connections came up a lot. FaceTime and connecting interpersonally was seen as a facilitator. Practitioners who don't usually engage in research wanted networking opportunities that allow them to engage with researchers, and they felt that this would improve the translation of research into clinical practice. They also felt that personal stories of patients who've been involved in research would be a strong facilitator and create empathy and personal connections that might help engage other families and patients in the research process. Opportunities that came up included using the time that patients spend in waiting areas or even the time they spend as inpatients as an opportunity for engaging them in the research process. For clinicians who were not typically engaged in research, they wanted easy entry points into research projects that would help them contribute meaningfully, but not in a huge way for which they didn't have the time or capacity. They also felt that linking the study outcomes to improved patient care or fulfilling service mandates, particularly for administrators and decision makers, would really enhance opportunities for engagement. There was an overall sense that the culture at the hospital prioritized clinical care above research. Strategies to change this culture were discussed at length in the consultation. However, some participants felt that this idea of a child-sized KT platform that could be a public-facing demonstration of better integration between the clinical and research worlds on our site. We also talked about engaging hard-to-reach populations. Community-based engagement came up a lot, going into communities and engaging with patients on their own terms and in places and spaces that they consider safe and inviting. This work could be spearheaded by community champions and local community groups like non-governmental organizations. They also emphasize the importance of culturally appropriate communication channels, and translation into different languages is essential. And of course, transparency of the entire process of patient engagement and participation in research is really critical with real-time reporting on the progress and results, rather than just telling patients the results at the end of the study, but really involving them throughout the whole process. In our consultation, when we asked our participants, what is child-sized KT? What we learned was that most people felt it is not one thing, it is a menu of things. It could be a patient registry, so a registry of patients who are interested in participating in research, a repository of all of the projects that are ongoing and available for participation. It could be used as a way to collect data, but also a way to conduct discussion forums. There could be innovative ways of engagement, such as using gamification, as well as providing training and toolkits to increase knowledge and awareness around what research is for patients and parents. And we could also integrate social marketing. It was seen as being a mobile enhanced web platform, and that I think is really important based on what we learned about parents' desire to be involved really online. However, They also had ideas like kiosks in the BC Children's or Sunny Hill waiting areas, interactive screens in patient rooms to facilitate engagement in research, or even a physical space that's dedicated to patient engagement. But what was consistently described was that it needed to be collaboratively designed, flexible, and multifunctional. The platform needs to enhance human connection and needs to make use of mobile technology. So after conducting all of that sort of consultation and the surveys, we then met with leadership representing BC Children's Hospital, the PHSA, the Research Ethics Board, UBC, Child Health BC, in order to get their perspectives on potential opportunities and risks. We started off by presenting our learnings, which I've just presented to you, and then went on to do a little bit of a SWOT analysis. And when we conducted this consultation, we learned about opportunities. And the opportunities that came up included the potential for this having a provincial scope. For example, working with organizations like Child Health BC, or also leveraging UBC Faculty of Medicine's distributed sites. I think most importantly is aligning with existing efforts. And we know that there are provincial efforts that already exist around patient engagement. And the goal of this work is not to reinvent the wheel, but rather to fill a gap in terms of doing this kind of engagement with children and families, which isn't necessarily something that currently exists provincially, but can align with what is already happening around the province. For example, the BC Support Unit's BC Healthy Connections project, which is leading the development of an online platform for BC citizens to be matched to research studies that interest them. Could catalyze KT potentially be the pediatric component of that provincial work? The leadership also suggested that more engagement was needed and consultation. A clear gap in our work so far is a lack of engagement of children and youth themselves, and that definitely needs to be part of the next phase of our work. Also, in engaging patients who came to BC Children's Hospital, the majority of them came from the diabetes clinic because I'm an endocrinologist. However, we do want to engage more broadly across different patient populations. In terms of risks, one risk that exists is redundancy and fragmentation. And again, this comes back to aligning with provincial efforts. How do we align and connect our efforts in such a way that we don't reinvent the wheel and we really leverage off of each other's infrastructure as well as experiences? Sustaining a platform like Child Size KT would be a challenge that needs to be looked at ahead of time. The cost of long-term maintenance and upgrades that would be required for such a platform, as well as trying to keep up with rapidly changing technology. The latest social media channel systems seem to change every month. Yesterday it was Facebook, today it's Instagram and Snapchat. What will it be tomorrow? And I think a new kind of evolution in where we are in the world around data has really taken a turn with the recent data breaches that occurred through Facebook. And I think it will create even more skepticism and more worry about sharing data, even with trusted sources, or even when we provide, reassurance that all of the safeguards are in place. I think, big data is really becoming a much more, controversial topic that we need to think very we have to be very thoughtful about. So in terms of our next steps, we've finished this consultation, which took us about a year to do, and we have taken that information and thought about where can we start. Child Size KT is a really big idea. I mean, we're not talking about something that we can create in a day, a year, or even a couple of years. We know we need to take small steps towards achieving the goal. And what we wanted to do was look at the information that we gathered and say, well, where do we need to sort of act first, and where are the opportunities? And so we've been fortunate enough to receive funding from the Child Bright Network recently, as well as from the Faculty of Medicine Strategic Investment Fund. And our plan is, as a first step in developing child-sized KT, is we will develop an online family portal that will combine child and family stories about engagement with research with gamification, like point systems and badges and that kind of stuff that's fun for kids to motivate children and families to learn about and participate in child health research. We hope to conduct some interviews with families and patients and children who have already participated in research to really gather their stories and their experiences in a way that's engaging. The next will be to share those stories with children and families in general to get their feedback. Is this engaging? And then also to learn from our population of children and families about how we could integrate gamification in such a way that would really help to motivate kids to participate in child health research. And again, when I talk about participation, we're really talking about participating across the continuum from identifying the problem, developing the research question, all the way to actually disseminating the knowledge. So I know this is our big idea, is child-sized KT. We're just in the very early stages of this work. And as much as I know that we're on a webinar, I know there are ways to interact. And part of what we're doing continuously throughout the process is really engaging people to understand what are your ideas about this big idea called child-sized KT. And so I wanted to just throw out some questions that I have to you in terms of this idea. How is child-sized KT relevant to you? What would make you use it? What would make it challenging to use? What is missing from our consultation? Who else should we consult with? And what is your big idea for child-sized KT? I know a lot of people watch this as a recording, so if you are watching it as a recording later on and not today live, please feel free to email me with your feedback. But I would like to now open up to questions and maybe hear some of your ideas on this platform called child-sized KT.
Great, thank you so much, Shazhan. That was truly a fascinating webinar. I really appreciate you putting together the content and sharing it with all of us across the province. We've got about 30 people in the virtual room right now, and I'm going to unmute your mic, so you might get a lot of background noise when I do that. And when I do, if you want to mute yourself, you'll find an icon just to the right of your name that looks like a little microphone. You can click that to mute yourself. So if you want to start thinking now about your questions for Shazhan, you can also use the chat function. You'll find that in kind of the bottom right area of your screen. You can send a chat and I will read your question to the group if you want to do it that way. So here we go. I'm going to be unmuting you all, so bear with me if there's a lot of noise. There is a lot of noise. Anybody have any questions? We have enough background noise that I'm making an executive decision to mute everyone. I'm sorry. So if you have a question, if you could please raise your hand. Alison Gerlach has just done that. Thank you, Alison. You'll find the raise hand feature in the right-hand panel. Alison, please, I'm just unmuting you.
Hi, can you hear me?
Yeah, we can. What's your question?
Oh, okay, great. Yeah, thank you. Yeah, I'm a community-based researcher engaged in early years research, child health research with a focus on child health equity. So a lot of my research is done in communities, with communities, particularly with Indigenous communities and families and programs. And so I'm just wondering, I'm really interested in transforming how I engage families in an integrated way with knowledge translation. I'm wondering how to engage with what you're doing in my current and future research projects so that so that it can expand beyond the population that you're engaging with at BC Children's?
That's a great question. And I think, when I sort of discussed the opportunities that came up when we engaged leadership, that was definitely a really important one. Was how do you expand this so that child health researchers across the province can actually engage in this, platform and use it and participate in it, as well as, people who are children and families who live across the province. So I think that's a really great question. I don't know that I have the answer for you today, but I hope to have it eventually. We're starting here at BC Children's because it just makes it a little bit more manageable, because you can imagine how hard it would be to start so big. That being said, I think a way to engage right now is really to give us your perspective from being a community-based researcher on how you think it would, what it would look like to engage with a platform like this. Because I think one of the big gaps in our knowledge is actually, what does that look like? How would it work for you, do you think, in terms of engaging with this kind of platform and being a community-based researcher? So, we know it will be online, it will be, technological. I'm not a hugely technological person, but we know that the access to it will be provincial at some point. But what I would love to learn from someone like you is, what do you think that might look like? And in the context of your community-based, very participatory research with the population that you work with, what do you think would be the necessary features that would really help you in the work that you do? So I've actually answered your question with a whole bunch of questions.
Yeah, thank you so much. I think probably the first step is to allow other people to ask questions here, but I will email you, and then we can maybe continue the conversation and at some future point, if that's okay.
That would be amazing, actually. Thank you very much.
Okay, thank you.
That's great, Alison. Thank you. Where are you located geographically?
I'm currently doing some research through the University of Northern British Columbia, but I'll be moving to the University of Victoria this summer. But my research is really broadly based across BC currently.
Okay, great. Good to know. I know we've got a number of folks who are affiliated with the BC Support Unit across the province tuning into this webinar. So if anybody is with the Northern Regional Centre or the Island Regional Centre, you might make note of Alison's work and how you might support her and work with her. Are there other questions in our virtual room? Anyone have a question they'd like to ask? Please raise your hand by using the raise hand feature in the right-hand panel of your screen, or use the chat function and type your question there.
I mean, if anyone has any answers to the questions I've posed, I would also be very interested in hearing your insights and ideas as well. So it doesn't necessarily have to be a question to me. It could be an answer to one of my questions.
Great point.
So I just, while we're waiting for people, if they have questions, just to Alison as well, one of the things that just came to mind as well in terms of how we could, make this more accessible across the province was also through the distributed sites, the medical school sites, and that I think is considered a huge asset to our province and through UBC. And I wonder if there's a way to leverage that infrastructure so that we could make this something that could be utilized more broadly across the province.
And Kent, I think maybe you were.
Yes, I was just about to chime in since nobody else seemed to be capitalizing on that opportunity, despite my best attempts to use a more fly-on-the-wall approach today. I'm interested to know from Shazhan, like for myself, I am what I guess you could call a second-generation pediatric patient in the sense that born with congenital cerebral palsy, I was one of the first patients in what is now the old Children's Hospital, and inspired by that, I have made much of my professional life in various aspects of healthcare and healthcare education, and I was recently asked to join the Childbright network after some fascinating interactions with Dan Goldowitz and some of his colleagues. But I wondered, in your efforts, Shazhan, how much, if at all, have you heard from anybody who was an early patient at Children's Hospital?
That's a great question. I actually have not heard from any patients who have sort of transitioned into adulthood, who had experiences, across their lifespan as a patient. So I think that's a great point and a very important population to engage. Just on that point, when we did do the focus groups with families, we did have some parents participate who were also patients in the health system, not necessarily patients since childhood, but patients within the health system. And we did see, different ideas and willingness to participate in this kind of platform, depending on whether someone had interacted with the health system or not. And so, I think that really drives home the importance of your question, which is, what is the role of, what is the importance of the perspective of patients who've, been through it all already? And I think there's a really important role there. And that's a really important group of people to engage.
Excellent, thank you.
Thanks for the question, Kent. Does anybody else in our virtual room have any questions or answers to Shazhan's questions that are on the screen in front of us? A reminder, the raise hand feature is in your right-hand panel, or you can use the chat function to type your question. Any other questions or comments? Going once, going twice.
Well, Pat, if I can just end then by saying, I did leave a lot of time for discussion, but I realize it's hard to put people on the spot. I have a list of questions here. We would love your perspective on this idea, and in particular, would love to know how you might want to use this kind of platform and what you would need out of it, and also what would make it challenging to you, so that we can sort of be prepared for those challenges and maybe, make sure that we consider them as we continue to move down this journey of developing this platform. So please do feel free to get in touch with me. My email is up there. Our team would love to hear your ideas.
Great. Thank you so much, Shazhan. And thank you very much for this presentation and for sharing your email address, which is helpful for anybody tuning in to the recording or who's participating today who wants to know how to be able to reach you. We really appreciate you. Appreciate you donating your time to helping bring along the health research community in the province of BC with this presentation. So thank you again. Our next webinar in this series, the BC Support Unit series, is on May the 4th at 12 to 1 with Shirley Wong, who is the Assistant Executive Project Manager of Data Management and Stewardship with the BC Ministry of Health. And coincidentally, speaking of data, she will be speaking on the Health Data Platform. So any listeners who are interested in that presentation, make a note of that in your calendars. The recording for this session will be up on our website soon, and we'll be promoting it via our website. our newsletter and via social media so that you can share it with your colleagues for those who might be curious about what Dr. Amed had to say today. So thank you again, everyone. I hope you have pleasant remainders of your Wednesdays or whatever day of the week you're viewing this, and all the best. Thank you very much.